So welcome to everyone today. Thank you so much for joining us for today's webinar, Mental Health and Mindfulness Across the Adult Lifespan. I'm Dr. Jeff Soloway. I'm the co-founder and chief training officer at MindWell-U. MindWell-U offers evidence-based online and in-person trainings in mindfulness to organizations across Canada and across North America. I'd love to welcome Dr. Corey Mackenzie, a special guest with us today. Dr. Mackenzie is a clinical psychologist and professor and director of the clinical training in the Department of Psychology, as well as an adjunct professor in psychiatry at the University of Manitoba. He's got his lab focuses on mental health and aging. Corey is also a special guest because I've known Corey for over 10 years now, and I first met him at the University of Toronto when he was a professor and I was a graduate student there, and he was a mentor in bringing me into the field of mindfulness, and we got a chance to work together and developed a really amazing project around mindfulness and education for teachers. So have a special place in my heart for Corey, and he's just an amazing guy. So happy that Corey joined us today. Welcome, Corey.
Thanks, Jeff. Thanks for having me. And I'll throw some of that love back at you. It's yeah, I can't believe it's been 10 years, and some of that early work we did was exciting work and important work.
Yeah, no doubt we'll tie it back into the conversation at some point. But I'd love to, just start off by getting a little bit of a background about you and the work that you're doing currently at your lab.
Yeah, so my aging and mental health lab sort of focuses on older adults' mental health, and also on how mental health changes across the adult lifespan. So, I mean, we take a number of different approaches to looking at this issue. We use large population-based epidemiological surveys to look at changes in mental health. We do our own sort of primary quantitative and qualitative research projects looking at sort of aging and mental health. I've got 7 students in my lab right now, 7 graduate students and undergraduate students, and a host of collaborators that I work with to do the kind of work that I do. And one of the things we'll talk a lot about today is one of my sort of passions, and one of my messages is a lot about sort of positive messages around aging and mental health, because a lot of the messaging that is out there currently is very negative.
Very cool. Well, yeah, maybe that's where we can start or continue about what do we know about mental health and aging?
Good question. So we know a lot about it today, and we knew very little about it even 20 years ago. So the field of sort of geriatric mental health is fairly new. There weren't lots of people doing this a couple decades ago, and now there's large networks of people. There are conferences devoted to this. There are journals devoted to aging and mental health research. So yeah, we know a fair bit about it now at this point. And that's some of what I'll talk about to start with, is just sort of how mental health changes as we get older, at least in terms of sort of from the time we're out of adolescence until we're in our 90s or older.
Mm-hmm. There was, well, I'll share a screen, a slide that I know you wanted to mention around depression and rates of depression. So what are we seeing here in this slide?
Yeah, well, this is a really cool study. This is a study by Blanche Flower and colleagues that they published in Social Science and Medicine, which is a good journal. And this is a study where they looked at self-rated depression, self-reported depression in the UK labor force. So this was a survey of every UK citizen who's working, of working age, and looking at sort of self-reported depression and anxiety. So this study, if you look at this slide, each one of the dots on this graph represents about 17,000 people. So in this study in total, there's almost 1 million people. So we get really sort of reliable findings from this study. And basically what it shows is that there's a sort of a hill-shaped distribution of depression in the population, where we get peak rates of depression in people your age, Jeff, and my age. So that's sort of, if you look at this graph, it's sort of mid-40s, that's when people are at the greatest risk for developing a depressive disorder or having clinical depression. And then you'll see that it's lower in younger people and also lower into later life. So this is a graph that I think surprises a lot of people because when we start talking about what we expect mental health to look like as we get older, a lot of people sort of expect the opposite to be true. They expect rates of depression to sort of increase with age because we assume that aging is kind of a depressing process. Right?
Mm-hmm.
As we get older, we experience kind of physical changes that people aren't super happy about usually, sort of receding hairlines and gray hair and a little extra weight around the middle and those kinds of changes, right? We tend to see dramatic increases in rates of chronic health problems that are more common in older adults than younger adults. So things like heart disease, cancer, arthritis, diabetes, all those things are strongly age graded. And then we live in a culture that's super focused on youth and beauty and attractiveness. So, if you go to Chapters or Indigo and go to the magazine section and flip through magazines, you just don't see older adults in those magazines. So all those things kind of like converge to lead people to expect that as they get older, it's going to be sad and a depressing time in their lives. And that's not what that data in that graph showed.
So even though we're seeing higher rates of more physical disorders arising later in life, we're not necessarily seeing the rise in mental health issues.
Right. Yeah, so I mean, other things too, right? So people are more likely to be sick. They're more likely to die from those illnesses in late life, so that as we get older, we're more likely to experience loss and grief from people in our social networks. So all these things, again, lead to this idea that we should see increasing rates of depression. And the fact that we don't has been labeled the paradox of aging. This idea that despite all these sort of losses and these negative things that objectively occur, we tend to see improvements in mental health functioning as people get older.
So this is a good news story.
Yeah, not always, but on average, it's a good news story.
On average, right? So the big question that lends itself or that follows is about what's going on here. What's, why the increase, or maybe why not high levels of mental health issues? What do we know about that?
Yeah, maybe before I get to the sort of the why question, maybe we can touch on some of the other aspects of well-being so that people can see it's not just depression that we're talking about. So we did another study. This is my former graduate student, Eric Carriolis. I think you know Eric, Jeff, and my wife, Catherine Starzik. So we published a paper just this year in the Journal of Happiness Studies looking at this model of eudaimonia. So lots of folks won't be familiar with this term. It's a term that came from Aristotle. So it's a very old term, and it has to do with sort of living a good life, living a meaningful, purposeful life. So it's very different from sort of the focus on sort of happiness or life satisfaction or kind of what we call hedonic well-being, which is kind of pleasure. So eudaimonia has more to do with sort of this process of living well, of living a good life. And we used a model of eudaimonia by Ryan and DC that's outlined on this graph that I have here. And basically the idea is that they define a eudaimonic life as a life in which people are mindful, a life in which people have values that are intrinsically rewarding to them. So they're doing things because they have personal values that are important to them, and they have freedom in terms of their ability to carry out goals. So they're not having other people tell them what to do, they're doing them because they have freedom for goals. And the theory argues that if you have those three things in place, mindfulness, intrinsic values, and freedom and goals, then you're more likely to have your basic psychological needs for autonomy and relatedness and confidence met. And if you have those basic psychological needs met, then you're likely to have good well-being outcomes in terms of hedonic well-being and eudaimonic well-being. So the study that we did, was sort of a clever study. We had 66 undergraduate students and one of their parents and one of their grandparents, complete measures that tapped into different aspects of this model. So you can flip to the next slide, Jeff. Oh, I don't have it there, sorry. So if you flip back for a second, what we found is that the oldest group, so this is the grandparent group in our study, had the highest level of mindfulness. They were most likely to report intrinsic values and freedom and personal goals. They had the highest level of basic psychological need fulfillment in terms of autonomy, relatedness to other people, and confidence in the activities they take on. And they also had the highest sort of hedonic well-being outcomes. So that study found that as we get older, we're more likely to have eudaimonic well-being. And a component of that is mindfulness that we'll be talking a lot about today. But this suggests that it's not just depression that goes down with age. It's that other aspects of well-being improve as we get older as well.
Well, that's really interesting. And I didn't get a chance to share this with you, Corey, yet, but we actually used a measure of eudaimonic well-being in a research study we did in 2016 with some researchers at the Sutter School of Business at UBC. So we implemented the 30-day mindfulness challenge, which is the core training at MindWell-U, and we put it across 5 different organizations across Canada. We had over 500 people in the study, and one of the measures that we used was it was the QEWB by Waterman, I believe, 21-item measure, and we found statistically significant outcomes from that. So from people pre to post in comparison to a control group,
right.
That people improved in this area of well-being, which we're really excited about. And one of the researchers at Sauder was also quite excited about using the scale because it hasn't been used in a lot of research studies around mindfulness.
True, it's a new scale, and it's going to be increasingly used. I mean, that's exactly what we'd expect, though, right? That people who engage in mindfulness should be more likely to sort of see and live their lives in ways that are consistent with their values and in ways that promote eudaimonia and well-being. So I'm excited to hear that. I'd love to see the paper. I'm not surprised at the findings.
Yeah, we were excited about the findings, and the researchers were a bit surprised. They were a bit skeptical going in, just because the training, the 30-day mindfulness challenge, is a bit different than a traditional mindfulness training. You know, it's online, it's 30 days, it doesn't have the same touch points. The core practice is a bit different. We're not teaching intensive meditation. We're trying to integrate mindfulness into people's daily life. So they were a bit skeptical, to be honest, but happily surprised with the outcomes of the study.
That's awesome. And hopefully we'll have a chance to get back onto this topic a little later, because I know that mindfulness-based stress reduction programs are kind of held up as the gold standard, but they're not accessible to a whole bunch of people for time and financial reasons. And there's a whole bunch of ways to get into mindfulness other than MBSR that are impactful and important. So I'm sure we'll talk more about that later, but I'm not surprised that your study with the 30-day mindfulness challenge found improvements in eudaimonia.
Right, and just to clarify for any viewers out there, mindfulness-based stress reduction is MBSR. Is that it's kind of a gold standard program, an 8-week program that's being taught or has been taught and well researched, and now I think what we're seeing is a lot of iterations or kind of innovations in the area of teaching mindfulness.
Right.
Did you want me to skip to the next slide there, Corey?
Yeah, to the next slide. So this is just continuing on with the same theme of how well-being and mental health changes across the adult lifespan. There have been some really good meta-analyses, which are studies that combine the results of a number of small studies to look at how personality changes across the lifespan. This sort of OCEAN acronym is the most commonly used acronym to capture what researchers typically think are as the sort of the 5 key components of personality, which is openness, conscientiousness, extroversion, agreeableness, and neuroticism. So we use this OCEAN sort of acronym to capture the big 5 personality constructs. And so this study shows, as you can see from the graph, it's pretty clear that conscientiousness, which is a really important facet of personality for health and mental health, improves as we get older. This is important for sort of health and mental health because conscientious people are more likely to take care of themselves. They're more likely to take care of their health care. They're more likely to sort of be aware of changes that are happening. So all those good things. So this shows that conscientiousness improves with age. And the next slide shows that we see the same pattern with agreeableness. There's this sort of, I'm sure you've heard it, there's this sort of idea that that older adults are sort of disagreeable or cantankerous, right? That we're going to be difficult to live with as we get older. It's not what the research finds at all. We find that as people get older, in general, we see increases in agreeableness. Older adults get along with other people better than younger adults do in general. So we see these changes in personality that mirror the other changes that I talked about: decreases in depression, increases in pneumonia, improvements in aspects of personality that are linked to good mental health. So this stuff all starts to paint this picture of good news for us as we get older, at least in terms of that first slide, from middle age to late life.
That agreeableness is an interesting kind of measure. Have you looked at that in relationships? Like, is that a component that people look at in relationships, both personal relationships and workplace relationships?
Yeah, it sure is. Sure. Well, because for exactly the reason that you're thinking, that disagreeable people tend to run into lots of trouble interpersonally in all kinds of contexts: workplace, marital and romantic relationships, friendships, neighbors. So yeah, agreeableness is one of the strongest predictors of satisfaction in relationships. And it's, we all know that relationships are one of the most important central features to good mental health. So yeah, lots and lots of research on that.
That's really interesting. What about, how does agreeableness, or what comes to mind for you around humility across the lifespan?
Great question. I'm not aware of any data looking at that question. My guess would be, given what I've just shown you, that that we would again see improvements or increases in humility across the adult lifespan. And if I think about that within my own social network, I think I am more likely to see humility in some of the older people that I have in my social networks compared to some of the younger people. What's your thoughts on that?
Well, I'm curious, just because humility was another one of the measures we used in that study with the 30-day mindfulness challenge, and we saw that humility changed. And we were looking at it both as a component of leadership,
right?
How humility helps leaders, as well as what I'm thinking about now is more relationships as well.
Yeah, for sure. To have humility in leadership is key, without a doubt.
We had a question from the audience about what happens to agreeableness after the age of 60. The graph ended there. We expect that it...
Excellent question. There's this sort of interesting thing in research in general, and that is that for many, many years, up until about 20 or 30 years ago, older adults were invisible in the research literature. We weren't interested in that question 20 years ago. So that a lot of the research that is in that meta-analysis is old research, meaning we don't have as much research looking at changes in personality in sort of 65 plus. But the evidence that's out there does suggest continued improvements in agreeableness, although as you saw in that graph, there's kind of a leveling off. But we still see smaller increments of improvements, but improvements into later life with that as well.
So I think our viewer is joking that their 85-year-old dad is not very agreeable. So maybe it's...
Well, it's funny because everybody can pull out examples that sort of run contrary to these data. And for sure, it's the case. When we look at this hill-shaped distribution of depression across the lifespan, we see decreasing rates of depression in later life. But we also know that there's lots of depression in older adults. I'm a clinical psychologist. I treat older adults with depression and anxiety. So there's lots of people out there who are struggling. It's just the population trends move in a different direction. So we don't... and this is often, it's interesting. There's this, all the people who are kind of tuning into this webinar will have come across these ideas of the silver tsunami, or impending crisis in healthcare with the baby boomers aging, right? This has been a sort of a constant narrative that's been in the literature for at least the last 10 years or so. And interestingly, there's some truth to that when we look at physical health because of what I said about chronic health problems becoming more common in later life. But it's not true in terms of mental health changes with age. So this idea that as the population ages, as that sort of traditional pyramid with lots of young people at the bottom and a few old people at the top starts to become more sort of inverted or starts to become sort of more rectangular, that people are saying, well, we're going to have this huge crisis, this geriatric mental health crisis. And I don't think that's the case. And the research doesn't suggest that's going to be the case. So yes, there are still older people who are not agreeable, who are depressed, who have very low levels of eudaimonia. But in general, the trend suggests that as we age, we're going to become more agreeable, less depressed, have higher levels of well-being.
We have another question, another good question coming in from one of our viewers. So thank you for sending them in, and we encourage you to ask any questions that are arising so far. And the question's, out of curiosity, what happens with neuroticism over time?
That's a really good question. So, it's a bit of a complex picture with neuroticism. We tend to see improvements in, if we talk about the flip side of neuroticism, it's often referred to as emotional stability. So we see improvements in emotional stability or decreases in neuroticism with age, although it looks like there may be a gender difference in that, where these improvements are seen mostly in women, not in men.
Mm-hmm. Very cool. All right. Well, there was, I think we had a couple more slides that we were going to show about why does mental health tend to improve with age?
Right.
That maybe I'll bring up here.
Okay. So yeah, this is a picture of Laura Carstensen, who's a really important figure in gerontology research. She's also a fantastic person, but she's very smart, very sort of dedicated to sort of the same positive aging message that I'm interested in. And she's come up with something, a theory called socio-emotional selectivity theory, that she uses to try to help explain why we tend to see improvements in mental health with age. So if you flipped, she's at Stanford University, by the way, in California. So the theory basically is portrayed on this graph here. And the idea is that as we age, we have different socio-emotional goals. So what you see here is that there's these two goals. One goal has to do with sort of knowledge expansion, expanding your horizons, learning new things. And what we see in the graph here is that knowledge trajectory tends to be highest in adolescence, in young adults. And that makes sense when we think about it. When you're a young adult, an adolescent, your future is expansive ahead of you, and you are interested in sort of expanding your horizons, gaining new knowledge, learning new things. You're in school, you've got 400 Facebook friends, that's sort of your life. Okay? Whereas that knowledge goal is not high in later life. So what Carstensen talks about is there's this other goal, this other sort of emotional goal, which is the goal around emotional fulfillment and meeting emotional goals. That tends to be lower in younger adults. And what she argues is that if we think of time sort of like an hourglass, and we think of the time that we have left in our lives in that way, and when you're young, you have all this time left in your hourglass, and your future is long and expansive. You don't even imagine what it's like. As you get older, and you start to realize that the time you have left is running out, the sands in the hourglass are running out, that's when we see the shift away from knowledge acquisition towards more emotional fulfillment. So basically the idea is that when we start to become more aware of our mortality, more aware that time's running out, we shift away from expanding our horizons toward meeting our emotional goals, having close emotional friendships, having something that you do in your life that is emotionally meaningful for you, those kinds of things. And there's tons and tons of research in gerontology showing that younger versus older adults behave very differently in terms of these two goals. And that you can experimentally manipulate sort of time perspectives by, for example, asking young people to imagine what things would be like if they had suddenly a terminal diagnosis of cancer and they only had 6 months to live. What kinds of things would they be interested in? So same things that you hear about, in the world when you know someone who's had a younger person who's had a terminal illness, their goals shift. They're no longer interested in finishing university. They want to travel. They want to sit down with their family, their friends, that sort of thing.
So it seems like that's a good point to bring in mindfulness and bring mindfulness into the conversation about how does that relate to that, to the emotional or knowledge trajectories. And maybe we can start by even, asking you, what is mindfulness?
Yeah, good question. And I'm assuming that a lot of the viewers in the webinar would have come across some definitions of mindfulness. There are a number of different definitions out there. John Kabat-Zinn's got a definition that has to do with paying attention on purpose to the present moment in a particular kind of way. And there's other definitions of mindfulness that have to do with sort of being more aware of what's happening in the present moment and being able to disengage from sort of unhealthy emotional states or conflict and things like that are happening. But the way that I understand mindfulness is it's two things. It's sort of an attention training piece where we're learning to be able to direct our attention more to the present, what's happening in the present, rather than ruminating about things that have happened in the past or worrying about things that may or may not happen in the future. So it's being more present more often. And then it's the quality that you bring to that present moment experience that we talk about in mindfulness. And those qualities are non-judgment, curiosity, kindness, compassion, those kinds of things. So it's present moment awareness, and it's being in the present moment in a particular kind of way.
And so if we relate that to that last theory we were talking about, how do you see that fitting in?
Yeah, well, the theory is very much a time perspective theory. So the idea is that when you're young, the theory says that our time perspectives are expansive, and we tend to focus on sort of future goals, and we think about the future as this very sort of expansive, long-term, nebulous thing. As we get older, and again, the awareness that time is running out becomes more salient, and we start shifting towards emotional, meaningful goals, it also results in a shift towards the present moment more so. So that older adults are more likely to be sort of present time focused, and younger adults are more likely to be future time focused. So, so that theory has built right into it this idea that we should, at least according to the theory, become naturally more mindful as we get older. And that is what we found in the study that I did with the undergraduate students and their parents and grandparents. Sorry.
So based on our poll, we're seeing a higher percentage of people on the webinar who are beginners in mindfulness. So maybe they're all just practicing when they answer that question, right? The beginner's mind.
Right.
Maybe that's the response. Beginner's mind is the notion in mindfulness that, we're always beginning again. And that's the practice of mindfulness, is always to bring your full attention into the moment and experience each moment as if it's your first time with a beginner's mind. And that's a practice because it's not easy to do. We drive the car into work day after day, and it's hard to experience that drive as if it's our first time. It's much easier to go on vacation to a new place and have your eyes wide open and really get into your senses of smell and taste and touch. Hard to do that when you're going over the day-to-day. But that's the practice of mindfulness. How do you bring, your full self into your daily experience, whether it's your first time or your 50th time? Yeah, and go ahead.
It's nice to see a lot of people who are sort of new to this. And I think that's one of the exciting things about mindfulness is that, it's been around since the dawn of time, essentially. But this idea of the way that we're pulling mindfulness into Western sort of psychology and healthcare and education and corporate practice is relatively new, and people are excited about it. And so for people who are on this webinar, sort of new to mindfulness, there's so many great ways to sort of find out more about it. Places like MindWell-U, there's good talks on TED. There are, there's Mindfulness magazine and has an online presence too. There is good sort of, there's so many places where you can learn about mindfulness and sort of incorporate it into your life.
Mm-hmm. Mm-hmm. And why is it an important skill as we age? How have you seen mindfulness improving different aspects of life, from relationships, finance, health, caregiving? I know you do work in the area of caregiving.
Right. Yeah, it's a big question. It's an important question. I think that, you and I have talked about this a lot. Mindfulness is an important skill for anybody to pick up, right? And
we shouldn't just wait till we're older.
Right. If we do that, it should just kind of naturally happen. But yeah, we can.
Right. That's what I mean. We don't just have to wait for it to naturally happen.
Right.
That's what I hear about actually the most. Going on meditation retreats or trainings. When I was younger, I would always have people who were a bit older than me, maybe in their 60s in the room, and they would always say, "Wow, I wish I knew this when I was your age, when I was 20, because this is such an important life skill."
Right. Absolutely. There's no doubt about it. And it is a skill that helps you navigate the challenges in life in a more graceful way. Right? So, we did work way back 10 years ago with students who are training to become teachers. We know that teachers are in a highly stressful job where there's lots of stress and burnout and turnover. So we thought it would be great to help teachers learn this skill. In the same way, around that same time, I was working with nurses in long-term care. We're caring for older adults with dementia. And that's an objectively difficult job, working with people who have Alzheimer's disease and dementia. But we taught them mindfulness, and that was really important for their kind of job satisfaction and burnout and well-being. So, across the lifespan, this is an important skill. It's just that as you get older, I think for some of the reasons that Carson's theory talks about, but also just because aging sort of makes you slow down a little bit. And that's good for you. That helps mindfulness to have a presence in your life. And I think about that peak, that depression peak in the mid-40s. We don't exactly know why, but part of it is linked to the fact that life is just super busy in your mid-40s. You often have kids, small kids, aging parents. You're often at the peak of your professional career, tons of demands, tons of stress, lots of things pulling on your time. And that's just not the case for most 65, 70-year-olds, many of whom are retired, have more time, can slow down and smell the flowers a little bit.
Right. I'm actually getting a clear message. It's not about, from you, Corey, that it's really important for these middle-agers about the skill, to bring in the skill of mindfulness into their life. Right. Just because of the demands that they're going through and the need to balance that out with something that's going to help well-being and self-regulation. Yeah,
no, I agree. If we look at the data, it is really midlife, middle age, 40s, early 50s, where people are at the greatest risk of running into mental health problems and could probably most benefit from skills like mindfulness. I think that's absolutely true.
We'll also be happy to know that we've been integrating our work within healthcare and within education. So we've been offering our training within school districts and healthcare authorities. We actually have it running right across Saskatchewan in all healthcare authorities. I'm pretty sure all healthcare practitioners in Saskatchewan can take the 30-day mindfulness challenge. We're also working with a number of big health authorities in Ontario, hospitals like 10 to 15 hospitals in Ontario who are making it available now. So we're trying to, I mentioned before about trying to make mindfulness more relevant and accessible. And these are busy working professionals. It's tough to get them into a room and multi-weeks and get them to sit down for 20 to 40 minutes to do a meditation. So that's why we're trying to start in baby steps in some ways.
Right. You know, but given how busy people are, your initiative that you talked about would fall flat if there wasn't a huge need for it, you know? So it's people's willingness to bring on something like mindfulness or mindfulness practice when they're at this peak of kind of stress and busyness really speaks to people's perceptions of the need to do something around stress management and dealing with mental health stuff. And I love that you guys are doing this in a flexible way that people can kind of fit into their lives.
Yeah, and we were talking a little bit earlier about kind of brief mindfulness interventions and what you see is that shift or the opportunity of changing the model of how mindfulness is being taught. Did you have some further thoughts on that?
Yeah, lots of thoughts on everything. You know what I mean? One of the things I think about is this kind of model of, pardon me, this model of step care in healthcare and in mental health. I'm not sure if you come across that.
Yeah, we actually work with Dr. Peter Cornish at Memorial University quite closely, and he's one of the leaders in that area. So we're actually doing a project with Peter across Newfoundland and Labrador, implementing a stepped care program. And we're going to be implementing the 30-day mindfulness challenge. It's a project that's being funded by the Mental Health Commission of Canada.
Amazing.
Yeah.
Yes. For people on the webinar who aren't familiar with this term, the idea is that you, if you have a population-wide issue like depression, then step care suggests that what you want to do is you want to start with the kind of broadest, low-cost intervention and provide that as widely as you can. And that's going to help address the majority of people who are suffering, but not maybe they're sort of like early days. For people for whom those kind of broad, low-cost interventions aren't enough, there's kind of a next step up, something more intensive and usually a bit more expensive. And then for those people, that's going to be great for a lot of people, and there's going to be a subset of folks there who still need more. And for those people, there's a sort of a Cadillac treatment, something like the mindfulness-based stress reduction program we talked about before. So so this idea of trying to provide different kinds of interventions to different people depending on what their needs are it makes a lot of sense, and it's really the best way to help people on a kind of a broad population level.
Yeah.
So I really kind of see these kind of briefer interventions as kind of fitting into the sort of the lower steps on these step care models. If you offer a program like yours, or a brief 4-week intervention for nurses like the one that we did in Toronto, you're just going to have more people that are going to be able to take advantage of that. And then for those folks who get a kind of a taste of it, if they want more or if they need more, then there's usually something more intensive that can be offered. I mean, not everyone's going to be able to take a week and do a silent meditation retreat. In fact, probably very few people are going to be able to do that. But almost anybody can sign up for a 30-day mindfulness challenge, or go onto TED and type in mindfulness and listen to a 10-minute TED talk.
Yeah, and I think that was really one of our goals, is how do we create an easy first step for people? Whereas if you can't necessarily sign up for a multi-week course, you can't be present on a Tuesday from 4 to 6 for 8 consecutive weeks. Right. Or maybe you're just not open or that interested to meditation per se. How else can we get introduced to this concept and practice of mindfulness in our daily life? Because it's not just not just a concept or not just an idea. It's like we're teaching this to kids in K to 12, right? We teach it as early as kindergarten, and now there's programs in a lot of K to 8 and K to 12 schools. So it's interesting, whereas younger kids are actually being introduced to mindfulness early on, right? And they could have parents who don't know what it is, right? And so now we're also bringing it into the workplace, where they're learning, but there's a little gap of people who haven't had that introduction.
Right. You know, as these things become more common and people hear about mindfulness more often and they hear about interventions, there's just, you know, there's lots of opportunities for people to find out more. So some of the people on this webinar are sort of at the beginning steps in terms of their interest in mindfulness or their practice of mindfulness. But hopefully this kind of a webinar or other things will spark an interest. And then I think you're right. I mean, I think that understanding what it is one thing, but really it's the practice of mindfulness, and doing a walking meditation or a sitting meditation or a body scan. Those kinds of things are where you actually learn about how this can make your life a bit better.
Right, and you know, I'd love to tie this back to the conversation around relationships, because one of the goals that we have at MindWell-U in integrating the 30-day mindfulness challenge in a workplace is trying to get people in the workplace to do it together and to build a culture, a way of being, a way of working together, so that it almost becomes a culture-based initiative that managers are buying into, leaders are buying into, you know, employees are buying into, and it becomes a way of working with one another. It becomes a literacy, so to speak, of communication and relating. And you know, we hear people all the time saying to take 5 when they see their colleagues stressing out, or when they're sitting down to one of their weekly meetings. How can we start that meeting with a take 5, and you know, refocusing their attention, you know, in the present moment, feeling your body sitting even in this moment, and your connection with your chair, your connection with your feet, and feeling your breath moving in the chest or in the belly, and reconnecting with breath for just a few moments, and reminding ourselves to adopt this mindset of non-judgment, of patience, of openness.
Yeah. Yeah, I love it. I mean, I love it. I mean, there's so many things that pull us out of the moment. And, you know, the thing that jumps to mind as the most obvious sort of distraction is our smartphones. You know, I don't know how many meetings I've been at where people are at the meeting, they're all in the same room together, but they're all off in different places. They're you know, off on their phones. They're not present with what's happening, and it's deeply unsatisfying. I mean, when I teach large undergraduate classes at university, I like to start the class not by kind of yelling, "Let's get going," like I used to, but by ringing a mindfulness bell. And students by the second or third class know that ring means to pause, to come to breath, to focus before we get started on teaching. And it's a small thing I've done, and it's a remarkable thing for me in terms of the difference that it makes in terms of setting the tone for a lecture. And I think the same thing applies to all kinds of things in our lives.
Well, that's really great. I'm going to welcome people who are watching. If you have any questions for Corey, to please post them now, or any comments about what you've heard so far, you're welcome to do that now. How big is the classes that you're teaching, that you integrate that into?
So usually I teach an undergraduate abnormal psychology class, and it gets it's a third-year class, and the biggest it gets is about 100 students. It's often a bit smaller than that as a third-year class, but I've taught it as big as 100.
Right. I was just wondering, because some university classes get huge, right? Like they can get up to like 1,000 students.
Yeah, we have those too in our first-year classes for sure.
Right,
yeah.
The first-year ones.
I've not taught those.
Yeah, it's another area that I'm really interested in terms of mindfulness in higher education. We work with a lot of universities and making it available for staff and faculty, as well as for students. And so there's a whole, you know, we did work around mindful teacher education, or teaching mindfulness to teachers, for more K-12 teachers. But I think there's a huge application for university settings as well, for educators there.
I agree. You know, interestingly, in our clinical psychology training program, and in lots of clinical psychology training programs, we are building in training around mindfulness-based cognitive therapy and other mindfulness-based interventions for serious clinical disorders like anxiety disorders, mood disorders. So it's, it's getting built in that way as well.
In our, we have just a few minutes left here, Corey. I wonder if there's any, just based on what you said, and when you're teaching it to clinicians, what are some strategies maybe that you might give to clients around dropping mindfulness into everyday life?
Yeah, it's a good question. I mean, in my private practice, I've got a small private practice where I see individuals who have adjustment problems, anxiety, depression, other things like that. I mean, usually what I do is I offer the choice of, we can use a kind of a traditional cognitive behavioral therapy treatment, or we can incorporate or move in a more kind of mindfulness-based direction. And what I usually do is I allow the clients to kind of make that choice, because I find that sort of pushing what I would like to see or what I think would benefit somebody isn't smart. So it's interesting. Over time, I found more people are looking for mindfulness or asking for it, and finding it more palatable. I think because of this work that we're doing in these kinds of discussions, people see it as less kind of fringe now as they might have 10 years ago.
I'd love, it's been something I've always thought was very interesting, the distinction or some similarities between cognitive behavioral and mindfulness. And then there's this blending of mindfulness-based cognitive therapy. Can you just speak to some of the similarities or the ways they come together or are distinct?
Sure, yeah. I mean, both approaches work with, pardon me, both approaches work with negative thoughts. So in depression, where people have a lot of frequent, severe negative thoughts about themselves and other people in the future, that sort of defines what depression is in a sense. In cognitive behavioral therapy, we get people to identify what those thoughts are, and then we sort of get people to start to battle them and challenge them. So we get people to sort of see if they can change the way that they're thinking. So in a mindfulness-based cognitive therapy approach, you also get people to become aware of negative thoughts, but you deal with them differently. So as you'd expect in a mindfulness practice, you notice them, you watch them come, you watch the effect they have on your body, you watch them go, but you don't label them as a problem, or you don't try to do anything with them. You just let them come, let them go. In both cases, you sort of learn to kind of detach from that negative thought and see that it's outside of yourself. So there's similarities, but there's some important differences too.
In our training, we talk a lot about thought trains. It's one of the central teachers and teachings and around. It's the idea that you're sitting at a train station and you have all these trains of thought or going through your mind. And with mindfulness, you're able to notice where that thought train is going, and you can choose whether you want to stay at the station and just let that one go through and wait for the next one to come on.
Right. And that is inevitably much harder if you're depressed and some of those thoughts are sort of, very kind of, I talk about them in terms of clouds, some of like the dark thundercloud thoughts, it's harder to do that with, but it's the same idea. And you learn how to do that in the same way that you do in any meditation practice. Yeah, I love that.
Great. Well, I'm totally enjoying our conversation here, Corey. I'm gonna just do a quick couple last thoughts and share with our group some upcoming webinars that we have, and then I'm going to come back to you for any final thoughts that you might have to share that you'd like to leave the group with. So I just wanted to remind everybody who's viewing right now that we're going to be sending you a copy of the webinars, today's webinar, that you're able to share with colleagues, maybe people at work or whoever you might think is interested. We're going to post a link that if you're interested to take the 30-day mindfulness challenge, you'll be able to sign up and take that. Maybe you've taken it through your organization, or maybe you're just like to sign up as an individual, so you're welcome to do that. And a nice part to the 30-day mindfulness challenge is when you register, you get to invite a buddy, and you do it with another person. So the buddy feature is like your workout buddy, so that you're not alone. So you are building a little bit of community, or you have a little bit of accountability as you go through the training. So we encourage you to choose a good buddy, because somebody who's going to help you stay engaged and while you go through the training. I wanted to let you know about some upcoming webinars that we have. We try and do a monthly webinar. Next, we've got April 4th, we've got an occupational therapist and MBSR teacher, Jeza Sulit, who's going to be joining us, which is going to be a wonderful talk on mindfulness and the road to recovery from an occupational therapist perspective. And then actually in April, we've got two. We've got a second webinar on April 18th, making mistakes in high reliability organizations. And that's with Dr. Ellen Choi. And she's, Dr. Ellen Choi's got a PhD from the business school at Western in the area of mindfulness. And her research, it'll be talking about the research that she did. So that looks to be another great webinar. So I want to put a special thank you also out to Dr. Corey Mackenzie for joining us. I know that he puts his energy into a lot of different directions these days, both everybody at the lab, his clinical practice, as well as his students, training people to go out there into the world and help others. And I know just from my own experience that you make a big difference, and it's such a pleasure to learn from you and learn with you. So I know that all the people that have the opportunity to learn with you, it's a real treat. And it was a treat for us to get to spend this hour with you. So thank you so much for taking time out of your day to come spend it with us, Corey.
Well, thanks, Jeff. It was a real pleasure. Always good to see you. Always good to talk with you. And this is a topic that we're both passionate about, and it's always fun to spend some time talking about it.
Mm-hmm. Yeah, we didn't even get a chance to really talk about Movember much, but I know that you've also done work around with Movember around men, and I know that we did a project around reaching men and using our training to help bring more men into this. So maybe that'll be the topic of another conversation we get to have.
Sounds good. Sounds very good.
Okay, thank you everybody for joining us today, and we look forward to seeing you on future webinars.
All right.
Bye everybody.
Bye.